All right, welcome to a late installment of Mental Health Monday. This will be part one about anxiety and panic attacks. In this video, I will just be going over the diagnostic criteria for both of those. Again, this is the DSM-5. This has a revised version that just came out. However, I do not intend to purchase it as they are very expensive right now. And since I am not working in the field, I don't really see the need for the expenditure at the moment. There's not too many changes that were made between this one and the revised version anyway. So I'm not inclined to purchase it at this point. So there are multiple forms of anxiety. Jump back here to the index. Using my craft stuff for bookmarks. So anxiety, there's agoraphobia is considered an anxiety disorder. So agoraphobia is the fear of the outside. Generalized anxiety, social anxiety, with panic attacks, without panic attacks. There's a selective mutism that is part of anxiety. So selective mutism is not speaking. Separation anxiety, phobias, and there's also anxiety that is induced from medications or substance use. So those will be covered separately as we go through what is anxiety and what do you do about it? What can you do about it? So diagnostic criteria for generalized anxiety disorder. I decided to start with generalized because it is the one that is most common. I think everybody has some level of anxiety, but not everybody reaches a point where it is interfering in their life and becomes diagnosable. Think about yourself. I mean, do you get anxious when there's something unexpected coming? Yeah. If your boss says, "Hey, I need you in my office today at 3, and it's only 9 o'clock in the morning, do you feel a little bit of anxiety, wondering what is the meeting about? Of course you do. Anxiety is normal, quote unquote normal. When it becomes to a degree that it starts interfering with daily function is when providers usually step in and look at therapy, cognitive behavioral therapies, rational emotive behavioral therapies, different modalities of therapy, and or medication to assist with the anxiety. Now, I've said before that I am anti-pharmaceutical for the most part. If it is something that can save your life or that will save your life, like heart medications or schizophrenia medications, I am all for that. But if your medication is being used as a Band-Aid, then it needs to be just a Band-Aid with the intention of it eventually being taken off because you've learned coping skills. So things like ADHD, anxiety, some depression. I do feel like medications are a Band-Aid that are used far too long, and people become dependent on those medications and never really address the underlying cause of those disorders. With ADHD, you learn to cope within yourself. You learn and develop skills to keep yourself focused and on track and get your stuff done. If you learn those skills, you can manage your ADHD without medication, in my personal opinion. Now, keep in mind, I'm not a doctor. I am not trained in mental health, but I have worked a lot in the mental health industry. As a drug and alcohol counselor, nobody and it's a co-occurring thing between mental health and substance use. it's pretty common to see people in mental health services and behavioral health services that do not have a substance use problem. However, that is not reciprocal. Very, very rarely do you find somebody that's in a substance use treatment program that does not also have some sort of mental health disorder, whether it's been diagnosed or not. So that being said, started with generalized anxiety disorder, and I will go through that a little further and take on each individual type of anxiety over the coming weeks. So generalized anxiety disorder, the diagnostic criteria. I was just wondering, making sure it didn't start on the other page. Excessive anxiety and worry occurring more days than not for at least 6 months about a number of events or activities such as work or school performance. So it's a constant worry. More often than you don't experience it. So if you think about on a week basis, more days than not. So out of a 7-day week, at least 4 of those, for example, you're experiencing excessive anxiety and worry. The individual finds it difficult to control the worry. No matter what you do, it's still there. The anxiety and worry are associated with 3 or more of the following symptoms, with at least some of those symptoms having been present for more days than not for the past 6 months. Only one of these 6 is required for a child to be diagnosed with GAD, generalized anxiety disorder. Restlessness or feeling keyed up or on edge. Being easily fatigued. Difficulty concentrating or your mind going blank. Irritability. Muscle tension or sleep disturbances. Difficulty falling or staying asleep or restless, unsatisfying sleep. So remember, for adults, 3 or more of those 6. For children, only 1. The anxiety, worry, or physical symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. The disturbance is not attributable to physiological effects of a substance. So physiological, again, is the body, not the mind. Or other medical condition like hypothyroidism. And the disturbance is not better explained by any other mental health disorder. Negative decision. Where's the end of the parentheses here? Oh, so this is all the example of other mental disorders. Anxiety or worry about having panic attacks in a panic disorder. Negative evaluation in social anxiety disorder. Contamination or other obsessions in OCD. Separation from attachment figures and separation anxiety. Reminders of traumatic events in PTSD. Gaining weight in anorexia nervosa, physical complaints in somatic system disorder, perceived appearance flaws in body dysmorphic disorder, having a serious illness in illness anxiety disorder, or the content of delusional beliefs in schizophrenia or delusional disorder. So as long as there's not any other mental health condition that's been diagnosed that also creates anxiety, it falls under the GAD. Often what comes with anxiety disorders, you get this, it's difficult to control the worry, that criteria B. Oftentimes for people, when they're dealing with high levels of anxiety, it actually can result in panic attacks. When I do my video for Friday, I will talk about my experience in being officially diagnosed with anxiety, as well as the panic attacks that led to that diagnosis. It was not a fun experience. Fortunately for me, mine was more situational. So once the situation was resolved, the panic attack stopped. So anxiety with a panic attack specifier. Symptoms are present for the purpose of identifying a panic attack. However, panic attacks are not a mental disorder and cannot be coded. So it's just it's a specifying thing. So there is a separate diagnosis of panic disorder, which I think, panic disorder is right here. But what I find interesting is that the abrupt stage for panic attack specifier is the first diagnostic criteria for a panic disorder. But panic disorder, you also have extra criteria that you have to meet in order to have that diagnosis. And I think panic disorder is you bypass the anxiety portion and go straight on physical panic. I think, don't quote me on that. I'm not super familiar with panic disorders. So if somebody that's listening, one of my subscribers, somebody in replay crew, if you are familiar with panic disorders or you experience them yourself, I would love to have a conversation with you. Maybe give me some insight. In the meantime, panic attack specifiers that go with anxiety. An abrupt surge of intense fear or intense discomfort that reaches a peak within minutes, and during which time 4 or more of the following symptoms occur. Okay, 4 out of the 13. Palpitations, pounding heart or accelerated heart rate. Sweating. Trembling or shaking. Sensations of shortness of breath or smothering. Feelings of choking. Chest pain or discomfort. Nausea or abdominal distress. Feeling feeling dizzy, unsteady, lightheaded, or faint. Chills or heat sensations. Paresthesias, numbness or tingling sensations. I'm not going to try to say that word again. Derealization, feelings of unreality or depersonalization, being detached from oneself. Fear of losing control or going crazy. Fear of dying. So think about your generalized anxiety, just those things that, bring yourself to attention. And then have you ever experienced any of these 13 specifiers? For me, my answer is yes. 1, 2, 3, 4, 5, 6, 7, 8 of the 13. When I was having panic attacks, 8 of the 13 I was experiencing. So just a short part 1 video on the diagnostic criteria for anxiety, generalized anxiety disorder with a panic attack specifier. And again, when I do my video for Friday, I will talk about my experience with being diagnosed with anxiety and the panic attacks that resulted in that diagnosis. So that's it for now. Thank you for watching. Hit the like button if you liked this information. And don't forget, I'm not a medical professional. If you feel like you are experiencing these symptoms, please seek out medical attention through your primary care provider or your local care facility. Thank you and have yourself a good day.